Coming up next, Dr. Ruben Contreras is going to talk about anti-inflammatory medications. You're listening to Health Matters with Maury and Shannon on the all-new North Sound 1380 KRKO Radio.
Health Matters, brought to you by Integrated Rehabilitation Group on North Sound 1380 KRKO Radio.
Today we have Ruben Contreras, family physician from the Everett Clinic with us, and Dr. Contreras is going to talk about anti-inflammatory medication. I know after being in the business for 20 years, a lot of my patients are constantly asking, should I take anti-inflammatories or should I not take anti-inflammatories? So Ruben, welcome. What is the purpose of anti-inflammatory medications?
Well, the anti-inflammatory medications are going to be the things that you can buy over the counter, like Motrin, ibuprofen, Aleve. Almost all the short-acting anti-inflammatories are going to be available over the counter. The purpose of them is basically to reduce inflammation. But you have to understand that all these medications have a lot of other properties like reducing pain and reducing fever. So anti-inflammatory effect is just one of them. And so what we're trying to do with the use of these medications is block a response that the body is having to inflammation.
So a lot of patients ask me, should I use Tylenol or an ibuprofen for an anti-inflammatory purpose? Do you have any thoughts on that?
One major difference between Tylenol and the anti-inflammatories. Tylenol reduces fever, it reduces pain. It does not have any anti-inflammatory properties. The anti-inflammatories reduce pain, reduce fever, plus, in addition, they reduce inflammation. So if you're trying to say what is the difference between them, if you're aiming to reduce inflammation, Tylenol is not the one that you want to use.
Good. Okay, that's an excellent answer because I know, again, a lot of patients are always asking that question. And when should patients use anti-inflammatories?
Anti-inflammatories are going to be best used in the first week of an injury. There's a lot of good studies out there show that it does work to reduce inflammation. But beyond a week, you're starting to block the normal response that the body wants to have to injury, and that might not be a good thing. So initial use is probably going to be the best.
Okay, is there any conditions that a person should not take anti-inflammatories?
The anti-inflammatories really cause problems more with chronic use and high use. I don't think that there's really a lot of reasons why in the short term they can't be used. That said, I think that we try to restrict use in certain conditions. For example, in kids, children, adolescents, we don't want NSAID use to be a part of getting out and playing.
Now, NSAID, that word, that is another term for an anti-inflammatory medication.
That's correct. We just use NSAIDs because that just is a quick way of saying non-steroidal anti-inflammatory drug.
Got it.
So anti-inflammatories, NSAIDs are all one and the same.
Another question that comes up a lot is how should people take this medication dosage-wise? Is it just follow the instructions on the bottle, or do you have any recommendations?
Recommended guidelines would be always what we are going to stick with. We know that the studies really show that fever and pain-reducing effects are occurring at a lower dose of the medication, but you really need to push the higher end for true anti-inflammatory effects.
Good. You're listening to Health Matters. This is Shannon O'Kelley on KRKO Radio. We're talking with Ruben Contreras, family physician from the Everett Clinic, about anti-inflammatory medications. Ruben, how long should one notice results after taking the medication? I mean, just kind of a typical span of time.
Well, the effect is going to be noticed within several hours, certainly within half a day of starting the medication, and then within a day or two, for sure, you're going to notice the effects of it.
Good. Is there any precautions one should take? Do you have any guidelines on precautions with your patients?
Well, like I said, we're going to focus primarily with our precautions on the younger athletes, the kids, and the very elderly. The elderly are going to be where we see most of our complications with the nonsteroidal anti-inflammatory agents, and that's primarily due to the stomach effects, the gastrointestinal effects, and also the renal or the kidney effects.
A lot of people, particularly people that lived in Seattle for a long period of time, are real concerned when they talk about anti-inflammatory medication and kidney problems. We had an athlete, a very well-known athlete, years ago that had some kidney problems based on taking anti-inflammatory medication. Do you have any thoughts on that?
Definitely. We know that the nonsteroidal anti-inflammatory drugs have effects on the kidney. by virtue of what they do chemically, they may alter the blood flow to the kidney. Of course, the kidneys are extremely vital organ for us in terms of fluid balance. And what we see is in situations where people may tend to be a little bit dehydrated to begin with, and then you add a nonsteroidal anti-inflammatory drug on top of that, you may further impair the blood flow to the kidney. And like all our vital organs, we need blood flow. Anytime you obstruct or block a flow to a vital organ, that's not a good thing. And so that brings to mind also where we want people to exercise caution, and that would be in any situation where you're going to run an extra risk for dehydration. So people involved in endurance sports, for example, half marathon running, where you may be out on a course for 3, 4, 5 hours, sometimes even longer, your risk for dehydration is going to be greater. And if you add the use of nonsteroidal anti-inflammatory drugs on top of that, you will run a greater risk for kidney damage.
So if you're taking anti-inflammatory medication, maintain good hydration.
Yes, and really avoid it. I would say you want to avoid the nonsteroidal anti-inflammatory drugs completely if you're going to be participating in an endurance event.
Good. Symptoms to watch for as you're taking these medications. Is there anything that comes to mind?
Yes. The primary side effect that people are going to experience on a very common basis might be the gastrointestinal side effects of these drugs. They all work by blocking the production of prostaglandins, which control the inflammation process, but those drugs are also blocked in the stomach, and the prostaglandins actually provide a protective function for our stomach. So when you block that, you're actually placing the stomach at risk for irritation, bleeding, ulcerations. And so the most common side effect that we're going to see when people take these medications are going to be stomach upset. And nausea, abdominal pain would be the things that would indicate primarily intolerance to the medication.
And you recommend taking the medication after you've eaten, possibly? Is food helpful for that?
Food is very, very helpful. It doesn't necessarily block the response completely, but we know that people can tolerate the medication sometimes better if they take it with food. And so there are going to be a lot of people who can take these medications without experiencing any acute GI side effects. But if you do and you want to stay on the medication, maybe taking it with food would be a very good thing to do.
Okay, we've been talking to Ruben Contreras, family physician at the Everett Clinic, about anti-inflammatory medication. Great answers, good information. And Ruben, you can be reached at the Everett Clinic. Is there a website or a phone number?
The website is everettclinic.com. And the phone for the Everett Clinic is 425-259-1177.
All right, Health Matters with Dr. Ruben Contreras on anti-inflammatory medication.